Okay, today we are diving into a medical emergency where, the clock starts ticking from the very first second. We're talking about anaphylaxis. And let's be clear, this isn't just a severe allergy. It is a full body crisis that can turn fatal in minutes. So the real question is, how do you win a race against time when you can't even see the finish line? And to really hammer home how high the stakes are, just look at this timeline. From an IV medication, we're talking about cardiac arrest in as little as 5 minutes. 5. An insect sting? Maybe you have 10 to 15 minutes. Even a food allergy, something so common, can shut the whole system down in 30 minutes. This is absolutely not a wait-and-see situation. It is a flat-out race against the clock. All right, so here's our game plan for this explainer. First, we'll cover what anaphylaxis actually is, then how to recognize the emergency. Third, the life-saving first response. We'll also touch on what happens when those first steps fail. And finally, we'll look at what to do after the crisis. So, first up, what is anaphylaxis? What's really going on inside the body? Well, it's not some localized reaction like a rash on your arm. No, this is a systemic meltdown. It's triggered by something that kicks off this devastating chain reaction inside you. And the official definition from the World Allergy Organization, it's pretty chillingly direct. It calls it a serious systemic hypersensitivity reaction that is usually rapid in onset and may cause death. Let's just break that down. Serious, systemic, meaning it's attacking the entire body, rapid, and yeah, it may cause death. There's really no wiggle room there. That's the clinical reality we're dealing with. So how does this whole body attack actually play out? Well, a big part of it starts with the airways. The body's own defense system goes into overdrive, causing tissues to swell up and muscles to contract. And the result is, frankly, terrifying. The airway literally starts to close, making it harder and harder to breathe. At the exact same time, the body's entire plumbing system starts to go haywire. The blood vessels become, they get leaky. This lets fluid pour out of the bloodstream and into the surrounding tissues. So this isn't just about causing some visible swelling. It's literally draining the circulatory system of the fluid it needs to keep everything running. And here's where it gets really, really dangerous. Because you've got these leaky vessels and way less blood getting back to the heart, the blood pressure just plummets. This is what we call anaphylactic shock. And at this point, the body just can't get enough oxygen to its vital organs. This is that downward spiral that becomes so life-threatening. Okay, so all of that chaos happening on the inside, it starts to show up on the outside as visible signs. The absolute key is knowing how to spot them and spot them fast, because that clock, it's always ticking. Really, it all comes down to two main things: a sudden onset and things getting worse fast. We're looking for those classic ABC life threats. A for airway problems, like a hoarse voice. B for breathing problems, like wheezing. And C for circulation problems, like low blood pressure or confusion. These are huge red flags. And yeah, you'll usually see skin changes like a rash, but, and this is a big but, relying on that alone can be dangerously misleading. And honestly, if you take away just one thing about recognizing anaphylaxis, let it be this: you cannot wait for a rash to appear. In up to 1 in 5 cases, there are no skin symptoms at all. 0. The entire battle is happening inside the body. Waiting for a visible sign could be a fatal mistake. Okay, this brings us to the most critical part of this whole thing: the immediate response. What you do in these first 5 minutes, that is what makes the difference between life and death. This is where we save lives. The protocol here is simple and honestly, it's non-negotiable. First, you recognize those ABC problems we just talked about. Second, you immediately call for help, get an ambulance on the way. And third, without any delay, you give intramuscular or IM adrenaline. Hesitation is the absolute enemy here. So where exactly do you give that injection? The guidelines are super clear on this. You inject into the anterolateral aspect of the thigh, or, put more simply, the middle part of the outer thigh. The reason for this spot is that it's a large muscle, which helps the adrenaline get absorbed as quickly as possible. And what about the dose? Well, this is where medical precision is so important. As you can see, the dose is carefully calculated based on age. For an adult or child over 12, it's 500 micrograms. For a child between 6 and 12, it's 300. And it goes down from there for younger children and infants. Getting this right is absolutely vital. But what happens if that first dose doesn't seem to be working? The protocol is crystal clear.
If after 5 minutes there's no improvement in those life-threatening breathing or circulation problems, you repeat the IM adrenaline dose.
Now, in some cases, even a second dose of adrenaline isn't enough to stop the reaction. This is a terrifying situation called refractory anaphylaxis, and it means the whole treatment strategy has to escalate fast. So, what exactly is refractory anaphylaxis? Well, the official definition is a reaction where those serious respiratory or cardiovascular symptoms just aren't getting better, even after 2 appropriate doses of IM adrenaline. This is the point where you absolutely need expert intervention.
And you can really see here how the care escalates. The initial response, right, is IM adrenaline and lying the patient flat. But when we're talking about a refractory case, specialists have to move to more advanced care. We're talking about starting an IV adrenaline infusion for a continuous dose and giving a rapid IV fluid bolus to fight that massive drop in blood pressure.
All right, last but not least, let's talk about what happens after the immediate crisis is over. Because surviving the event is really only half the battle. Making sure it never ever happens again is just as critical. A huge part of prevention is understanding the common triggers. And this data on hospital admissions is actually pretty fascinating. For kids, the #1 trigger by far is food. But look at older adults. For them, the main culprit is actually drugs or medications. Knowing this is so important for targeting how we prevent these reactions. So, what does a safe discharge plan look like? Well, it's a really solid 4-part strategy. #1, every patient gets referred to a specialist allergy clinic. 2, they're offered an adrenaline autoinjector to have on hand. 3, they get full training on exactly how to use that injector. And 4, they get a personalized emergency action plan. Absolutely nothing is left to chance. You know, after going through all the complex science, the scary symptoms, and the different treatments, it really all comes down to one simple, powerful message. And it's this: the risk of giving adrenaline when it might not be needed is tiny, absolutely tiny, compared to the catastrophic risk of not giving it when it is needed. So the final word is simple. If you are in doubt, give the adrenaline.
So we've gone through the plan, we've seen what happens inside the body, we know the signs to look for, and we know the response. The question now is, are you ready to act?